Hi all. Today we are going to see about types of sleeping disorder. What are the types that comes under the sleep? Okay, I mean the sleep disorder. Okay, the first one is dysomnia. Okay, a sleep disorder may exist alone or as a part of more complex clinical problem. It can increase vulnerability to other difficulties. For example, doing poorly. If a person does not have a proper sleep, they can't focus on anything. Maybe it can be of their workplace or it can be of their studies, whatever it can be, they can't concentrate if the individual is not having a proper sleep. Okay. Okay, sleep disturbances affect about one third of the US population. People with sleep problems worry about immediate. They are not able to sleep properly. Okay, effects. Why it causes effect of family life, employment. Maybe if they are working means it will affect their family work everything. Okay, sleep disorders commonly occur in disorders defined as DSM-4 TR. Okay, insomnia is almost everyone sometimes has short term insomnia. Many people they can't even fall asleep, they won't even get a proper sleep. They will have difficulty in like the quality of sleep will be very less. Feel not rested upon awaking. Okay, about 10 percentage of adults experience in the current generation, about 10 percentage of the adults experiences persistent difficulty falling or staying asleep. Okay, if the problem lasts at least 1 month, it may be diagnosed. That sleep should be more than 1 month. If they have more than 1 month, it is diagnosed as insomnia. Okay, and insomnia is the most common sleep disorder. How these insomnia is affecting is irritability. Okay, anxiety, depression. If the person is having a depression, they can't sleep properly, so it will lead to insomnia. Okay, they can't concentrate on a particular work or their routines. Okay, preoccupation with sleeping difficulties. Okay, so here Shakespeare describes insomnia emotionally, oh sleep, oh gentle sleep. Okay, he is describing the sleep as like this. The next is what are the causes that causes insomnia and yes, the causes insomnia often begin suddenly due to stress but may continue after the stress ends. Okay, if the level of the stress become less also means the insomnia will continue till the end. Okay, it's more common in the aging elderly peoples. Okay, duration may vary. It can be a month or 2 month or 3 month or lifelong pattern. Okay, often occurs with if a person is having, as I said before, if a person is having an anxiety or a depression, it will affect them. Okay, people may complain about being unable to during if the person is not having proper sleep, they can't do the work properly. Okay, insomnia reflects inadequate sleep duration. They don't have enough sleep. Okay, poor sleep quantity, they can't sleep continually for 8 hours. Okay, poor sleep quality, the sleep quality, if they sleep for 8 hours also, that won't be much satisfied for them. Okay, difficulty in initiating for getting sleep also, they will be having some difficulties. Okay, yes, the next is narcolepsy. Okay, narcolepsy involves marked daytime sleepiness and sudden onset of REM sleep. REM means rapid eye movement. Okay, narcolepsy means if the person is working or do studying anything, they will suddenly fall asleep. Okay, that's what narcolepsy means. And when they fall asleep, they go almost directly to REM sleep without passing through normal stages. Okay, that's what they are saying here. They may experience they will having frightening dreams like nightmares. Okay, sleep paralysis, cannot they can't speak or move during the sleep. Okay, narcolepsy seem to have genetic component, especially related to genes on chromosome 6. Okay, these narcolepsy is rare but still involves hallucinations or paralysis. Okay, example, Sydney, a 16-year-old student, Developed excessive daytime sleepiness. Suddenly falls asleep for a seconds to a minute, often in the middle of the classes. Okay, this is the narcolepsy symptoms. Sometimes wakes to teacher calling his name. Teacher thinks he is lazy. He cannot control. This is the symptoms of the narcolepsy, but the teacher is not aware of that. So he or she thought that he or she is lazy. So he can't wake up. He can't stay awake in the class. Okay, he cannot control it. Teachers are reluctant to believe him. Misses important classes. He will miss that. If they fall asleep, they will of course miss the classes, right? Friends sympathize and helps with notes. Friends can tell when he is about to sleep. Yes, this is the now. Thank you.